Okay. So we've already talked a little bit about the assessment piece, but I want to cover in a little bit more detail. So let's think about, I hope one of these markers writes right enough. So let's talk about the assessment piece. And when we get an assessment, there's multiple things that we need to talk about. So we want to gather a lot of information from the patient, so the subjective and the objective data from the patient. So once, if we're looking at somebody, and I'm kind of including gallbladder, pancreas, liver, everything in this assessment, okay? Because if you look at both of those, you can kind of encompass both of those things or all three of those disorders into essentially the same assessment. You're going to cover a lot of things. So the first thing we want to do is sit down with the patient and get a detailed history. So I've put up here social, medical, and medications. So social history, what do we want to know? Patient presents to you no matter where they are. If they're in the ER, or if they're in the ICU, or if they're in the medical surgical unit, wherever they are, we want to get a detailed history. So when I say social, what do we want to know? Okay, drinking and smoking. Ooh, that's not going to write very good. So drinking, smoking, drugs. Okay? So before we move on any further with social, what do we want to, we know we've asked them if they drink, smoke, or do drugs, but what further do we need to find out?
How much?
Okay, how much? So how much?
For how long?
Okay. How long? How often? What type? So we want to know, do they drink beer? If they drink beer, how much beer do they drink a day? If they drink whiskey, how much whiskey do they drink a day? If they're smoking, or if they're chewing tobacco, how much are they doing? What type? How often? If they use drugs, we want to know, do they take PO, pain medications? Are they using IV illicit drugs, illegal drugs? And how much and how long have they been using them? And, taking that further, are they using clean needles, or are they on a needle exchange program? Does everybody know what that means? Okay, so they're legalizing that more and more, and they're bringing, cities are recognizing to prevent disease processes that it's better to use needle exchange programs. So those are some of the things. So patient comes in, that really needs to be priority. What if they're coming in with some of these presenting signs and symptoms? What do we, because we need to identify what the cause is. So other social things, what do we need to know about? Okay, so their job, that's good. So job. And what about their job? Okay, so toxins. How long have they worked there? So like some of these plants, they put out toxins. One I think about close to me is Logan Aluminum. So, they're dealing with molten metal, molten aluminum, and, they're going through that process. They have a paint department, so those folks are smelling chemicals. I live very, very close to TVA, which is, right now they're a coal-fired plant, so they're putting out toxins and chemicals in the air. I literally live, you can see the smokestacks from my house. So, some of those things are really important. What other social things do we need to know about?
Travel.
Okay, so travel. So what about travel history? What do we want to know?
Have they been out of the country?
Okay, so international travel. Why would that make a difference?
Exposure to different things. Like I think that my husband was in the military and was harmed with things.
Okay, right. So, and that's another thing, maybe you're not traveling for leisure, maybe you're traveling for your job, or maybe they're in the military, or, something like that. So, international travel, and do they have water filtration systems? Because that could expose them to different toxins, different organisms, and those kinds of things. We think about drinking, smoking, and drugs. We think about those things in relation to the pancreas and the gallbladder, and we can think about those because we know smoking can cause cancer, but we also think about those in relation to the liver. Okay, travel's the same way because somebody can contract hepatitis through drug use. They could contract Hep A through contaminated water. Those kinds of things. So those are all really important things. What's another social thing that we think about or that we need to know about? That's exactly what I was looking for. Unprotected sex. Okay, so we want to know lifestyle. So social and lifestyle. Okay, so those are some really important things that we need to find out. What about medical conditions in relation to an assessment of the liver, gallbladder, pancreas? What were you going to say? Okay, so past medical problems. So
Current.
past, current. That's all exactly right. So what things do you think could predispose somebody from that would be past or present medical problems that might have a relationship to the gallbladder, the pancreas, or the liver? Okay, so diabetes, very good. What else?
You said would high cholesterol have any?
Okay, so high cholesterol.
Hepatitis.
Okay, hepatitis. All right. So those are all really good things that we can think of that, off the top of our head that might have an impact. Somebody who may be having like problems with flare ups with their gallbladder, that could cause some problems with the liver and the pancreas. Okay, so like somebody who's got chronic cholecystitis, kind of comes and goes, they have biliary colic, that can cause some backup with the gallbladder and the pancreas. Okay, so all of these diseases. What about medications? What are some medications that we want to be aware of when we're thinking about the patients in relation to these disease processes?
You talked about acetaminophen if you take too much.
Okay, so Tylenol, acetaminophen. What else?
Like Norcal that has.
Okay, has acetaminophen in it. So we want to think about some narcotics and what their properties are. That's hard to read. Okay, what others? What are some of the medications that can cause long-term liver damage? Anybody think of anything? You have to have your liver function test monitored if you're on this class of medications. They also cause leg cramps. Statins, yes. So statins. So statins can cause, and statins are like your Lipitor, your Crestor, all of those medications that help lower the liver help to lower the cholesterol and the lipids. they can have lasting effects on the liver. Okay. Um, what does our liver do? We've already talked about that in relation to drugs. So it metabolizes. Almost every drug has to metabolize through the liver. So if we're metabolizing drugs through the liver, all of them can cause damage over periods of time. So we have to make sure that we understand, what these drugs can do to the liver. That's why that like Tylenol and all these over-the-counter medications have got warnings on them that says do not take more than the prescribed dose. So, no more than 6 tablets in a 24-hour period, no more than 8 tablets in a 24-hour period based on that dosing amount, because long term it can cause problems. Okay. One thing, so people have, they have chronic pain, so that might be another thing. Chronic pain may relate to this, so that those two things go hand in hand, and then you can have problems with liver. Now, what was one of the first things we talked about in GI? What was the first umbrella that we talked about in GI? Does anybody remember? Y'all don't even remember. Okay. What about oral health? Okay. So people who have bad teeth, sometimes they don't go to the dentist. They take a lot of Tylenol, a lot of ibuprofen, and those kinds of things that can cause damage to the liver. Okay. So those are just a few things. But so do you see why it's really important to get a detailed history on the patient? And sometimes it's like pulling teeth, getting information out of them. Where have you been? So has anybody been with a nurse in nurse observation and seen them admit a patient? Okay, so a couple of you have. So when we admit patients, some of the things that we ask are, have you traveled outside of the country in the last 3 months? Okay. Do you drink alcohol? How much alcohol do you drink? Do you smoke? Those are all part of the social history when we're collecting information from the patient. And all of that needs to be taken into consideration when you're planning what care that you're going to do for your patient. Okay? All right. Anything that you all think of that we missed? Anything? Let me look at my list here and see. One thing is family history. I didn't put that up there. So family history. What do we need to know about family history? What would be important? Okay, so any liver disease in the family. What else? Genetics. So somebody might have hemochromatosis. What is that? It's too much iron. So that can be a genetic or familial disorder. So somebody makes too much iron in the blood can cause damage to the liver. Okay, so it's important to know if someone has hemochromatosis. It can also cause problems in the joints, okay? And it can be fatal if it's left untreated. Let's see. So let's talk about alcohol consumption. Let me just say this. It takes about 60 grams, 60 to 80 a day for men, which would be four beers, 4 glasses of wine, or 4 mixed drinks to cause damage. And those folks will be considered high risk. Okay, that's for men. For women, it's 40 to 80 grams a day. Okay, that's in your book. You all can look at that. So then let's talk about geriatric considerations. And there's a chart in your book, 49-1, and it just talks about geriatric considerations. So what happens as we age, we've already established that everything decreases. Okay, so the liver size is going to decrease. It's going to decrease. So our ability to metabolize drugs, what's going to happen with that? It's going to decrease. Okay. And they can become toxic quicker. So what do we need to take into consideration when we're passing medications on this older population? They might need a lower dose. They very well might need a lower dose. What about let's talk about what happens with them with the gallbladder. So what happens? Is the gallbladder going to work as well? Probably not going to contract the way that it should, so we're not going to get as much bile, okay, as we get older. So after meals, we might, they may not, their digestive process might not be as quick, okay, and we've already talked about that a little bit. Okay. So let's talk about the physical assessment. So remember I said, this can cause problems in all body systems, right? So we can see neurological. So what do we want to look for neurologically?
Changes in their mental status, like whether they're alert or
Okay, so their level of consciousness. So alert and oriented. All right. So go ahead. What? Okay, so
if they are alert, maybe they're not.
Okay, confused. It might be pleasantly confused. So what happens, let me say this in relation, and I'll probably say this again, but when we think about the ammonia level in the blood, okay? So remember I said ammonia was the breakdown of what? Protein. And so it puts off ammonia. So when we break down protein, if our liver's not working right, it can't break that down the way that it should, and the liver can't rid the body of the ammonia, which is the end product. So it goes to the brain. And what happens is it causes what's hepatic encephalopathy. Somebody did that on the board, and we'll go over that. So it causes hepatic encephalopathy, and patients are very confused, okay? They can't process things. It's not that they don't know you. It's not that they can't answer your questions. It's just that it causes a major disconnect in the brain, okay? They can't make you really understand what they're doing, okay? For instance, one time, my husband, when we were trying to go to Vanderbilt, multiple times we were trying to go to Vanderbilt, and I was trying to get him out the door. And his ammonia level was elevated, and we were needing to go to Vanderbilt because I knew he was dehydrated. So I'm trying my best to get him out the door. And so he would go out the door, and then he would go back in the house. And I would say, what are you doing? And he would say, I got to get my important stuff. And so he would get one thing that was laying on the counter, and he'd put it in his pocket, and he'd go back out the door, and then he would go back in the house. And I'd say, what are you doing? I need my important stuff. And so he would get something else. And then, I still couldn't get him in the car. We finally got all of his important stuff in his pockets. And then I missed him and couldn't find him, and he was in the bathroom. And I walked back there, and I was like, we have got to go. They're waiting on us to, admit you or whatever. He takes his belt off and combs his hair with what little hair he had, combs his hair with his belt. His belt he just takes it out of his pants and starts combing his hair. Well, all you can do is laugh. It was hilarious, but I was like, that is the process, when the ammonia level is up. You can't reason with them. You literally cannot reason with them. They just, and they know that they're doing things inappropriately and they know that they're doing things that they shouldn't, but they can't stop themselves. Okay? That you can draw an ammonia level to see if it's elevated, if they're confused and you know that they have liver dysfunction, but the number doesn't really mean a whole lot because you're going to go more on what their signs and symptoms are and how they're presenting. Okay? Some of the things that can, the reason you got to do such a good assessment, because one thing will lead back to something else. So like dehydration will cause the ammonia level to be more elevated, and that'll cause the confusion to be worse. So these folks they can have fluid overload, but they can be dehydrated at the same time. And I know that's strange, but they can be fluid overload from the ascites. Their vascular space is dehydrated, but their peritoneal area and their intervascular, like their third spacing of fluid, so they're overload, but they're dehydrated at the same time. So they're really, really tough to manage sometimes. But this right here, confusion can be one of the first things that we see. Okay, so level of consciousness. What about their skin? What are we looking for with their skin? Bruising. Okay, bruising. Bleeding. Jaundice. Petechiae. Okay, so those are some of the things. We also, they may vary their color. Okay, they could be jaundice, they may never be jaundice. Okay, they could be very pale, so they may have pallor. They may be pink, depending on the degree of dysfunction that they have. Okay, they may have, they may have yellow sclera, but the skin is not, not discolored. So you always want to check that sclera. Okay, remember, where did I tell you the other day if you were checking jaundice on a dark-skinned person? Palms of their hands, right? We're waving. Everybody's back there waving at me. All right, what about the GI system? What can we see with the GI system? Did anybody say anything? What do you think? So everything is kind of connected in there and it's not working the way that it should. So what can we see?
They have loss of appetite.
Okay, so loss of appetite, that's exactly right. Okay, what else? What about nausea and vomiting? Okay, they may have nausea, vomiting. So those are some of the signs that we need to be looking for. We need to be asking the patient. And then, have they lost any weight? And how much, over what period of time of weight loss have they experienced? And then the nausea, vomiting, how long does it last? Does it precipitate with anything? Can they not eat certain foods? Because we're just now gathering a history. We're trying to find out. This person's just presented, and we're trying to figure out what's going on. Okay, so we want to know when these things take place. What can we see with the GU system?
Decreased urine output.
Okay, so we can have decreased urine output. What else? What's some of the other things we can see? So with men and with women, we can see decreased libido, and we can see secondary amenorrhea. You can also, there can be some other GU, mostly it's going to be decreased urine output. That can be related to the dehydration. It can be related to the renin system and how everything is connected. Okay. but those are just some signs that we want to be looking for. Now, musculoskeletal, what can we see?
Have atrophy with that?
Okay, so they're going to have muscle atrophy. Now, that's really late, like that's as the disease progresses with liver disease.
Every
Okay.
person I've seen is late stage,
Yes,
so they're all.
yes. I meant to bring my photo album today of my husband and I forgot, so y'all could see how distressed that I was because of him. I weighed 118 pounds. That's quite a lot less than what I am right now. But yeah, I did. He was like he had 7% liver function in July before he got transplanted in September. So he was almost dead. I mean, I knew he was going to die by Christmas. He was not going to be with us by Christmas. And he was pale, emaciated, had no muscle strength, no muscle mass. I mean, like he was the classic sign and symptom. He just didn't have jaundice. He was just pale gray. He had ascites. He had a pleural effusion. Everything that's on that little man, I could have drawn it from what he looked like. It was unbelievable how he looked. So I knew that we weren't gonna, he wasn't gonna be with us very much longer. So some of the other things we can see are like with cognitive is slurred speech. We can see, let's see, a tremor. And we can also see skin breakdown. Those are some of the things we didn't write up there.
What about itching?
Okay, very good. Itching, pruritus. And why do we have itching?
Because the ammonia is coming out of your skin.
Because either the ammonia or the bile. Because bile backs up, and so what colors our stool and our urine? Does anybody know?
Dark and gray.
Okay, okay, so the stool, and that's something else that we want to assess, is stool. So it can be gray. Did you say dark?
Gray. It's a gray stool and dark urine.
Okay, dark urine. So why are those two things? What does urea do? So that's what colors our stool. And if we're not producing it because we don't have the liver function, then we're going to have gray stool, okay? If that is backing up into our skin, it's very itchy. Think about bile salts to help emulsify fats. So if that's backing up into our skin, it can be very irritating to the skin. So what intervention are you going to do? What intervention can you do for somebody that's got itchy skin? You want to put them in a hot shower?
No.
Okay, so what would you do? So a cool bath, oatmeal, yeah, and like non-irritating lotions, non-fragrance lotions, and those kinds of things, because we want to soothe them. You think about if you get into a hot shower, it feels so good. I love to get in a hot shower, but when I get out, like my skin is dry and itchy, and I just want to get lotion on it. So, think about that whenever you're dealing with these folks, okay? All right. Let's see if I missed anything on there. Oh, one of the other things is we can see in males, we can see gynecomastia. And one of the other neurological things that I forgot to say were their recall is poor, but their abstract thinking is even worse. If you have them to try to think, abstractly about something, it's going to be difficult for them. Let's see. We can also see edema. I didn't write that up here. We can see edema. We can see in the extremities, especially those lower extremities, but we can see edema all over. Okay, let's talk about labs and diagnostics. So I've written up here some of the things that we will look for, but specifically on the LFTs, what do we need to look? What do we need to be looking at?
Your ALT and AST.
Okay, so ALT and AST. Which one is the most specific? Which one is most specific? One of them is most specific to liver dysfunction. ALT. Because AST can elevate when there's heart damage, when there's muscle damage, we can see that elevate. But ALT is specific to the liver. We also want to look for ALK phos and a GGT, okay? So ALK phos, that's alkaline phosphatase, and a GGT. So alkaline phosphatase, that is a test that we want to look for to confirm that it is hepatic in origin, that the problem is coming from the hepatic area. Because if the alkaline phosphatase is elevated, that could mean that there is bone damage, okay? Or because it's made in the bones, okay? It's made in the bones, it's made in the kidneys, and it's made in the intestines. The biliary tract, it excretes all of that. So if there is no bone disease present, if a patient does not have bone disease and their alkaline phosphatase is elevated, then that means that it's probably coming from somewhere within the biliary tract. Okay, so the absence of bone disease, then we can be pretty sure that something. Now it may just be that there's a stone that's blocking the common bile duct. There could be a number of things, but what we want to look at is we don't want to look at one of these things individually. So remember I said that cholesterol can cause problems because of the fat deposits. So we want to look at those cholesterol levels, the HDL, the LDL, and the triglycerides, because that's going to help to tell the story as well. Why do I have PT up here?
That produces clotting factors.
Because of the clotting factors. So we want to look at coag studies. Coag studies, I cannot stress to you how important that they are. Why are they important? When we're thinking about procedures on patients and doing things for patients. Because they can bleed out. So it's really important to know what your coag studies are before your patient has any kind of procedure done. Okay?
Didn't I think I read where vitamin K, if you gave it to them, it's not going to do anything.
Right. I mean, you've got, it has to be taken for a little while, but you've got to make some adjustments. Okay? There's got to be some other adjustments done. And then why do we want to look at protein? Why is that one important?
That's the breakdown of ammonia.
Because of the breakdown of ammonia. But if their protein and their albumin levels are low, then that impairs the healing process, because we have to have protein to heal, for our bodies to heal. So remember we just talked about skin breakdown right here? If our protein levels are low and this patient has skin breakdown, then you can see how that can go hand in hand. So we've got to look at this because, one, we're not synthesizing protein the way that we should, because the liver is in charge of doing that. And if the liver can't do that, then our protein levels are going to be low. It can impact ascites and cause problems with ascites, but then we're not going to heal the way that we should. Remember I said it affects every part of the body. So if you've got a skin breakdown, it's not going to heal. If you don't have the protein, then let's see. We've got muscle atrophy. we've got protein, okay? That goes hand in hand. Protein causes, or lack of protein can cause this, because you got to have protein to build your muscles, right? Okay, so those are some of the things that I really want you to be aware of, especially your LFTs, okay? That proteins and LFTs, those are all really important. But AST, ALT, GGT, ALK phos, that's kind of under that heading of liver functions, okay? Let's see. Also, bilirubin, you want to kind of know what your bilirubin is, and they may do that serum and they may do a urine bilirubin, okay? Other things. So, ultrasound, they may do an ultrasound. So, as the nurse, what's your role? If a patient's going to go down for a liver, gallbladder, pancreatic ultrasound, what's going to be your job?
Don't you want them NPO?
So, NPO, exactly. So NPO about 8 hours. All right. And this is that's a common procedure that we do to find out if somebody has got liver dysfunction. Okay. They'll do a gallbladder. Maybe it's coming from the gallbladder. They're looking at the gallbladder. They think maybe the patient has gallbladder disease, but in all reality, they've got liver dysfunction. Or they're looking to see, because they're presenting with all these signs and symptoms, they're looking to see, is there a stone in there, or what's going on, okay? Or is it actually, truthfully, the liver is failing, okay? They can also do a CT. The most definitive way to see if they rule out, if they go in and they rule out if there's anything wrong with the gallbladder's functioning, there's no problem, they do a gallbladder ultrasound, the ultrasound's fine, they send them for a HIDA scan, the HIDA scan's fine. They will possibly, if the LFTs are elevated, the patient is showing signs and symptoms through through some of these things, then if everything is pointing in that direction, they're probably, next thing they're going to do is either a liver biopsy or an exploratory laparotomy, okay? Because through an exploratory laparotomy, they can do a liver biopsy. Most of the time, they're going to just do the liver biopsy because they don't want to take the patient in for anesthesia if you don't have to. You don't want to put somebody under anesthesia. So let's talk about a liver biopsy, because these sometimes are done at the bedside. Okay, they can be done, most of the time now they take them for special procedure, but they can be done at the bedside with a mobile ultrasound. So if you're the nurse in charge, what's going to be your first thing you're going to do if you know your patient has got to go down for a liver biopsy, or if you're going to help with it? What's the first thing you want to do, aside from getting a consent?
I was about to say consent.
So you want a consent, but what's the first thing? What's the most important thing? I've already told you all. What? So NPO, they do need to be NPO, and after NPO, then what? I've already told you. Do what?
Would you check any of their functions?
Okay, you would check something, but what would it be? We've already said they're going for an invasive procedure. They are sticking a needle through the intercostal space.
PT.
And they're going through the intercostal space. The patient is going to be lying on their side with their arm up, most likely, and they're going to be sticking a needle that's about this long into the intercostal space, and they're going to be jabbing it in there and pulling it out really quick, getting a hook. The patient is not asleep. They have to do this awake, because the patient has to be able to breathe and hold their breath. Because you think about every time that those lungs expand, and so they have to expand those lungs and hold them so that they can go in there and get the biopsy. It's pretty quick, but my husband said it's pretty painful too. He's had one, and he was like, they did not put me to sleep, and they came at me with that needle that was really, really long, and it looked like it had a hook on the end of it. So what did y'all say?
PT.
Okay, so they're coag studies. So PT and INR. Because we don't want to send these folks down to the nurse in the procedure area and the nurse go, well, sorry, they have to go right back upstairs. Okay, so prior to, these are what we've got to do. We've got to get a consent, make sure that the patient understands, and if not, then what do we have to do? Call the provider, get them to come back up there, because we're not supposed to be getting informed consent, we're just obtaining the signature. Keeping the patient in PO, coag studies, and anything else that's been done, the diagnostic studies. But these coag studies, just think about it. If those coag studies are elevated or they're out of whack, then that patient could bleed out after the procedure. So what could, if they've got blood or fluid in there, in the abdominal cavity, what can happen? We talked about it the other day in GI. Peritonitis. Okay, so you got free blood and fluid and everything else floating around in there. Okay? All right. After the procedure, what are we going to do? Okay, monitor for bleeding. So how are you going to monitor?
Looking at the site.
Okay, so watching the site.
Would you do the H&H?
Okay, so look at their H&H. What about their abdomen? What do you need to do as far as an assessment on their abdomen? So distended, what did you say? Okay, so palpate it. Palp. And then look for distension. Okay, how are we going to position these folks? Right after procedure. So we've done a biopsy. For instance, if we had a biopsy on the skin, we're going in there and we're taking out some tissue, okay? If we do a biopsy anywhere, what do we have a tendency to do? Coag studies, we have a tendency to bleed. The liver is vascular, a large supply of blood. So we can hemorrhage, go into shock. So we can't put direct pressure on the liver to keep it from bleeding, right? So what can we do to keep that liver from bleeding afterwards? What position? Okay, so on the right side, you just said this a while ago.
Put them on their side with a pillow.
So you can put them on their right side, because when you position them on their right side, and your book has a wonderful diagram, there's a chart or a box in your book with a diagram of exactly how to position the patient after the procedure. So you're going to put them on the right side, because if you turn them on their right side in a right lateral position, that liver is going to fall down against the ribs. So that is working as pressure, okay? If you want to, you can put a pillow that will help to exert some pressure on that liver bed and keep it from bleeding. So we're going to position them like that for probably about 4 hours, just to make sure. In the meantime, we're going to be monitoring them for signs and symptoms of bleeding, which are going to be hypotension, tachycardia, any distended abdomen, any board-like abdomen. So anything like that, we're going to be monitoring them for, okay? All right. So as soon as the procedure's over, you got to get them on the right side, you got to get them turned, and you got to monitor. Okay, that's really important. And then when they get ready to go home, you want to teach them not to cough, not to do any forceful coughing for, you know, at least a day or two, and immediately in that post-op period we want to keep them from coughing. And then no heavy lifting, bending, pushing, pulling, straining, or anything like that, because you know, you think about, you've had a biopsy there, and it's just that liver area is going to clot just like, you know, just like any other area, and you could break that clot off. Okay. Let's see. Does anybody need a break? Y'all need a bathroom break or anything? Okay, so let's take a quick break. I might need to take a break too. I didn't take. Did you get your everything turned in? Good, good. Oh, I need to tell Miss Pullen that we need some.